Jones.
Thank you for your statement, Cabinet Secretary. The goal of making Wales a dementia-friendly nation is one we all share. Dementia is now the leading cause of death in Wales, and the number of people affected by dementia is expected to rise by around 40% over the next decade. The fact that Welsh dementia sufferers, their families and carers can directly feed in and shape Wales' first dementia strategy is most welcome, and I look forward to seeing the results of the consultation in due course. Regarding the draft dementia strategy itself, I have a few questions relating to the high-level performance measures. You have set a target of ensuring 2/3 of dementia sufferers have a formal diagnosis by December 2021. How did you settle on this target, and why is it not more ambitious given the obvious benefits of a formal diagnosis brings? The strategy sets a target for the percentage of NHS staff who come in contact with the public who are trained in dementia care. The target is for 3/4 of the workforce by 2019. When can we expect to see 100% of NHS staff trained in the appropriate level of dementia care? The Welsh Government rightly wants to see a reduction in the percentage of people with dementia prescribed antipsychotic medication. However, you haven't indicated a target for that reduction. Granted, there may be a few cases whereby this is necessary, but all the experts agree that we should not be using these medicines to treat dementia. Cabinet Secretary, will you be using guidance to ensure that the use of antipsychotics are only used when strictly necessary? I welcome the fact that the strategy highlights that dementia can strike at any age and the role that alcohol can play. We need to better educate the public about the risks of alcohol related to dementia and brain damage. Cabinet Secretary, what plans do you have to increase public awareness about the fact that alcohol misuse can lead to dementia? Finally, Cabinet Secretary, what plans do you have to improve access to substance misuse clinics so that we can hopefully prevent more people from developing alcohol-related dementia in future? Dementia is one of the biggest health challenges facing our nation, and it is therefore vital that we get this strategy right. I look forward to seeing the responses to the consultation and working with you, Cabinet Secretary, to deliver our shared aim of a dementia-friendly nation. Diolch yn fawr.
Thank you for the comments and questions. I think in terms of trying to deal with those, I've answered points about diagnosis, and I look forward to hearing what the consultation says and about what we've got in the plan and what is realistic and achievable for us to actually deliver. Part of the point we're trying to get across is that there's a need to have a continuing increase and improvement in the diagnosis rate at a rate that is real and material, and to see that carry on. Now, I recognise that many people will urge us to be more ambitious. We need to understand what is really coming through the door and what is our ability then to actually improve diagnosis rates with different partners acting at different points in time. So I'm happy to hear what the consultation has to say before we make a final choice. That is, after all, the point of having a genuine consultation. On your point about staff and staff training, I'd like to deliver what's in the plan and learn from that afterwards about how we then have more NHS staff being trained and appropriately equipped. And it's also that staff in health and social care, but in a wider field as well. And that's why the advice, the guidance that we launched before Christmas really does make a difference. It was actually a very useful event in actually meeting people in Ysbyty, Ystrad and understanding what they'd already done and the training that had taken place, and improvements in the patient experience that had taken place as a result of that training and provision being in place. And I recognise the point you make about the use of antipsychotics and where they're appropriate. That's part of the point that we talk about it in the plan. But I particularly want to deal with your comments about substance misuse. There's something here about the join-up between the different plans and strategies we have. Recognise that we do talk about substance misuse and the plans that we have to improve substance misuse provision to help people to get through that as well. And in particular, though, the alcohol-related brain damage crosses a number of different areas of activity. We know that there is some work that we've been supporting in and around Ogmore in looking at this particular issue in terms of the treatment, the provision and the research, but also members who are here in the previous assembly have heard me discuss some of what's been taking place, for example, in the Liverpool and the Glasgow areas as well. It's important we continue to learn from other parts of the UK, but what is likely to be a continuing challenge. You know, more and more people are going to be coming through doors with alcohol-related challenges, and in this area in particular as well. And lots of those people will actually be more affluent groups of people coming in with alcohol-related challenges in dementia. So we've got to think about how we deal with a range of our different challenges, understand what the current evidence is about what is effective, and then how that impacts not only on diagnosis, but actually treatment and improvement that we need to have, which will be different in the future to what we have now as well.